And I have the honor actually to introduce to you the large project we started with the JIR cohort, namely the CliPS project. And lupus nephritis is a part of the CliPS project as a rare disease. And let's move on to the next slide. So I'll tell you about how this whole idea came from and just introduce to you what CliPS means. So CliPS means clinical practice strategies. So that's actually strategies that you use to manage your patients in daily clinical practice. And what are we doing? You know, why would we like to help you with developing clinical practice strategies? And actually this starts with the guidelines, the European guidelines that we developed on the support of PRESS. Next slide, please. So this project was the JIR project, supported, it's a European Union funded project and supported by PRESS. PI was Nico Wilfred from the Netherlands, and we actually worked on providing evidence-based, and if there was no evidence, consensus-driven recommendations for diagnosis and management of connective tissue disorders. And I think many of you are familiar with them, or maybe the younger ones not yet, but this was done by a systematic literature review at the start, and we used the EULAR standard operating procedures for that. We try to transform the evidence into recommendations, and then discussed these recommendations in like a few years ago with an expert panel and discussed them, voted on them, and finally came to these recommendations. And a lot of papers came out. I listed them all here. A few on lupus, APS, IgA vasculitis, rare pediatric vasculitis, autoinflammatory disease, uveitis, JDM, and also localized scleroderma. Because, you know, guidelines are one thing, but implementing them in clinical practice is another thing. And there's a Dutch saying, and it's been famous, the soccer fans, I don't know, Tim is here, but we have a famous soccer coach who said at a meeting when he had to talk about competing against totally different soccer clubs, he said, well, that's another cook. And that's actually literally a Dutch saying, that's another cookie, it's that it's totally different. And I think a lot of people asked us, you know, why are you developing clinical practice strategies where you can actually use the guidelines? Well, guidelines are totally different. It's really another cook. You have to implement them in daily practice. And there's lots of limitations, and we all actually know them. Because extrapolating study data to your clinical practice, you know, what really helps the individual patients? Study data are large group data. There are statistical significance, yes or no, but we don't know if our patient is on the one side or on the other side. What's very important too is your local habits. If you've been successful in these rare patients with a certain medication approach, it's really hard to change that if that's only said, you know, from a paper, and you can say, well, you know, we have a little bit different situation. I'm not sure if I should change that. The other thing is availability, what's available in your practice, but specifically your country, regarding diagnostics, regarding medication. Do you have national rules? And even within Europe and even within countries where, you know, biologicals are available, the description rules, for example, for belimumab in lupus, are very, very different. And you know, what are the patients' references? What do they want? And do they want to continue the steroids, or do they say after 3 months, why don't you get rid of my steroids and give me something else, because I hate all these steroids? So I think training, I didn't even discuss training. There's different health systems. I think there's way more arguments that we all know that we have to have local practice strategies, clinical practice strategies that are locally available, and they can be built upon guidelines, but they need to be more explored. And the aim actually of the whole CliPS project is that wherever you are in the world, that you get the best available treatment in your country for that disease. Just a little bit how this then in practice will work. So, and then I'll use, I used the cookie already, and I like to eat, I like to I'm a gastronomic person, so I'd like to use the cooking book analogy for the CliPS practice strategy project. So we chose 5 clinical conditions, 5 rare diseases: lupus nephritis, small and medium-sized vasculitis. We chose biological treatments for inflammatory disease, FAPA and SERV, and systemic onset JRA. So 5 different rare diseases. Specifically, the autoinflammatory one is, of course, a big group, but then we focus on the biological treatment. And we see them as, having had different cooking books for our library of cooking books. And, for lupus nephritis, you can use a Swiss cuisine, you can have the French cuisine, which is different in the different countries, but you can also eat vegan. And vegan can be something that you eat in all the different countries. So meaning it doesn't need to be related to a specific country. So we continue. So we have these 5 topics, 5 catalogs. So I'll try to now take the example of lupus nephritis. And within lupus nephritis, there are a lot of topics that we need to discuss. What are you doing for diagnostics? What are you doing for treatment? And how do you, for example, monitor your patients? And again, you can see that if you look at your cooking book at the starter, the main course, and the dessert. And if you even go into more detail for the topics, we would like to know, what's your practice strategy in your clinic to do the treatment? What kind of follow-up, what kind of induction treatment do you do? What kind of maintenance? So really, do you like the chocolate fondue, or do you like the merengues, or are you a sorbet person? And I think adding this all together, that's what we try to inventorize with our project. So we need all of your help that are present, and even way more people, to inventorize clinical practice strategies that you have in your country, in your practice. And then finally, we'll add up, we have those clinical practice strategies regarding diagnostics, treatment, follow-up, and other things. Then we do those clinical practice strategies per topic, like what I said, so treatment, diagnostics, and, for example, follow-up. And this we do for every rare disease that we have that we chose to do. So 5 different catalogs, 5 different diseases. With all, if you then go down, I just went up in the pyramids, but if you go down, you will have a library with the 5 different diseases. We cover different topics, and for every topic, we'll have different clinical practice strategies.
I will continue with the presentation done yesterday by Sylvia. So she already really discussed why we went in this project. So she explained it very well, so I don't want to go back to this. I just wanted to say that this is a long-term project, and also that it's very inclusive, meaning that people who are interested really are very welcome. We will go through a few questions. Why this project? When? How? Who? And now where we go. Next slide, please. So the aim is to collect the clinical practice strategies worldwide about 5 different rare inflammatory medical conditions. So the aim is to collect these clips and then to gather them into a repository that will be then disseminated. The timeline of the project, we have 4 phases. First phase is the preparation. We are arriving at the end. We had already a kickoff meeting in Châteaudet in October. And now we can launch the questionnaire in the few days or 2 or 3 weeks from now. And then, as you see, the project will continue for many years, we hope, for the development of this repository and then for the dissemination. And the idea is, when we have this repository, is to update it regularly. Now, how will we do that? We will disseminate questionnaires, and as you can see here, for each of the 5 topics, there will be a specific questionnaire, and there will be also some question on the demographic of the participants and also about local constraints, because this is an important hurdle to treat patients according to recommendation are often the local constraints. So the distribution of the questionnaire will be worldwide, and we need the help of local representatives, first of all, to disseminate the questionnaire, and also to know to whom we should disseminate these questionnaires, because we don't know who are really taking care of the patient in the different countries and how it is organized, and this is very important, and here we will really need your help. Now, how are we organized? So we are organized in 3 different circles. If you look for the first circles, they are leaders of the project. They are responsible for the global strategy, team recruitment and management, and also about the finances and the sponsoring. Second circle are the teams from the 5 different diseases, so 5 groups in Circle 2, with one leader from the Circle 1 leading the group. And this Circle 2 is for the scientific purpose of the study, publications and meetings. And finally, we have Circle 3 with the regional representatives who will help us to give us local support. And up to now, we have already the members of the first and the second circle, and now we are looking for the third circle. And then we will have participants worldwide who will fill the questionnaires. And what is very important, we have an administrative team. And so here is the list of the participants. In green, you see Circle 1, in blue, Circle 2, and in orange, already 3 persons from Circle 3. I will come back to this in a few minutes. And you also see how many countries are already participating to this project. So really, we are eager to have lots of participation. So if you are interested, really, you can contact us. And now, how will we go forward? We have to launch the data collection, and for this we have 2 ways. The first way is through a project which was funded by the World University Network, and where we will send the questionnaires in 4 countries participating to this WUND project, in Brazil, Ghana, New Zealand, and in Switzerland. And if I come back, you see here that Jackie Jan from New Zealand, Christina Lana from Brazil, and Difa Day from Ghana are already participating and will be our local representative within this project. And now we need other regional representatives.